I think those are very exciting times to be a psychiatrist. I think we have so many opportunities right now which we never had before. It kind of puzzles me that ketamine is not so widespread in Israel as it is in the States. I think it has to do a lot with the regulatory issues. I think it's an issue we have to tackle because it definitely has so much potential for so many disorders which we just can't treat. Stable disorders, you mentioned here, depression. I can also mention addictions and eating disorders, all of which has almost no treatment. And we can only maybe handle with some psychotherapy and maybe a bit of pharmacology. But ketamine might be an answer for all of those, and we might be the people who will be able to deliver that. I see the things that Sinai Oren is doing in his clinic. I see what your guy is doing right now, and I see so many other centers trying to tackle those issues, and I think it's a big opportunity for our patients. I myself work in a very big private clinic. We see many cases, about 40,000 cases a year of patients with many different psychiatric disorders. And I think the one singular thing that works for all of them is when we can do some teamwork on those cases and where we can combine different solutions. And I think the right way to approach ketamine is with teamwork, because we can give people ketamine just like they do in so many places in the States without doing psychotherapy, without following them with psychotherapy, and just give them ketamine just like we give Cipralex. But we can also make some other model that can combine psychotherapy with ketamine and with family support and with social support, and then actually make a protocol that can make those people feel better. So I think this is the big fight that we have to fight. We have to make the regulation believes that ketamine is something that is worth fighting for, because it's not going to be easy. I've been trying to figure out for the last couple of years now why ketamine is not that widespread here. And I think it's partly because of our motivation as doctors. We prefer to stick to the old tricks and not to the new ones. But I think it also has to do something with the health ministry that has to accept the fact that ketamine might be something that may offer new solutions. And,
Ilan, let me just respond briefly to that, because I touched on this in my talk, but I just will go into a little more detail. The regulatory process is really a hamstring. It's really tying up the progress, but it's not unsurmountable. Just by comparison, in the United States, any physician can use any medication for an off-label use for whatever he wants or she wants. Now, if you do malpractice, you have to, be accountable for that. But if you have good evidence for using a medication, you don't need anybody's permission. In Israel, it's not the case. You need to go through this process called Itzlim Gimel, and it has not been an easy process. We have so far managed in our practice to find our way through this, and we are getting permission for each and every patient. However, it is certainly, and we're pioneering this for others afterwards. I don't know, but they're very, very circumspect. It's a pharmacy-run process, not a medicine-run process. We have managed to overcome, at least for now, and made it through various, I won't go into the details, but I'm not complaining about the pharmacist. I'm saying that this is the path that needs to be trod, and we've done it so far, and hopefully we've opened up the path maybe for others to be able to do so as well.